Hi, and welcome to Across the Desk. This week, well, Kevin Stitt is at it again, and he's been at it because this isn't something new. It seems we passed State Question 802 last year and put Medicaid expansion into law. Well, here comes Kevin Stitt, wants to throw the monkey in the wrench and mess up the works, or give his powerful buddies the money out of this, because here we go, managed care, Sooner Care 2.0 on steroids that he just hijacked from State Question 802. Now, I don't know if you've noticed over the last few weeks with the snowstorm and the rolling blackouts, but Kevin Stitt came out with a press conference a few weeks ago with a one Kim David, who was censured for what she said during this press conference, and a Kevin Corbett, who pretty much was the face guy, salesperson, pitching the managed care program that Kevin Stitt wants to implement. I found this very curious because, considering that last year we passed this into law by citizens initiative petition, it was pretty specific and it went into our Constitution. Of course, Kevin Stitt was against this. He wanted to do his Sooner Care 2.0, where we had work requirements and everything else, and really cut down the limits on who would be in the program. So we didn't go for that. We passed this into law. And what happens is, well, Kevin Stitt comes around like he usually does, and he does what he's good at. He throws the monkey wrench in the works and watch it go kaput. And that's what he's trying to do here. That's exactly what this is. Don't be fooled. This is a conservative's way to mess something up that's good for the people, because that's not conservative values. Conservative values are fend for yourself. It's not their values like Democrats and liberals are. We care about your quality of life and how we can make that better for you. Conservatives aren't about that. They're all about, you need to do that on your own. Or, hey, I don't like these people. What can we do with the government to make their lives even worse? And that's what they do. How can I make my fellow American citizen that I disagree with, how can I make their lives worse for disagreeing with me? And that's pretty much what they like to do. And that's kind of what we see here in a little bit, and we're seeing it in a kind of little twisty way. Because one of the curious things I found out about this was their argument against expanding Medicaid in State Question 802 was the fact that it was too costly. Oh man, it's going to cost $160 million a year that we got to come up with, the 10% match from the federal government. Oh, that's too costly. How are we going to come up with it? Well, actually, they came up with a way. They were going to increase hospital fees to cover it, and the Hospital Association was so good with this. This is exactly how we're going to do it. We're going to manage it, we're going to pay our extra fees as hospitals, and we're going to get the extra 90% from the federal government to match and make up for everything. Wow, that's great. They agreed to that. Which actually, this managed care plan kind of puts that at risk. Because one thing the managed care plan does is it raises the cost of the Medicaid expansion that we wanted to do. Because here they are, griping about $160 million cost a year. But when you look at what they say at this news conference, it's going to cost $2.2 billion to set it up. That's a lot more than $160 million. I mean, that's a lot more than $160 million. Way more. And the funny thing about this, not the funny, I don't know that it's really funny. I don't even know that it's curious. I think it might be a little infuriating that when you look at the numbers, just the dental plan for managed care, just the dental, not anything else. $110 million a year to manage that. Just the dental. That's almost as much as the $160 million to manage the whole thing when we passed it in State Question 802. That's what that is. So we're raising this like a lot. $2.2 billion is a lot to manage this. And what does that do? Well, it's going to cut services. And they even say so. Hey, you know what? This is going to reduce inpatient care by 40%. It's going to reduce mental health by 20%. And this is insanity. But this is total conservative thinking. Because, hey man, we want you to be able to fend for yourself. You shouldn't have to depend on anything from the government. We don't care how poor you are. They don't help those people. One, those people don't have money. Republicans like money. They like people with money and organizations with money because Republicans like money. They are total plutocrats. It's one of their base values, plutocracy, definitely. And you hear about me talking a lot. They definitely are plutocrats. He who has the gold makes the rules. And that's exactly kind of what we got here. You have guys with a bunch of money, the health insurance industry, which believes me, pretty wealthy bunch, has money. They can throw that money around and get what they want to happen. And I believe that may be happening because we don't really know a lot about this. This is the funny thing about it, because they really haven't been transparent about this. This has just been the governor and his cabinet and people he has working on Medicaid expansion through a managed care system. No one in the legislature knows what they're talking about over there except for Kim David, and she isn't talking to anybody else. And everybody else over there saying, hey, I don't think this is going to work, and it's got to go through us first. Why are they trying to go to the medical authority here in Oklahoma to get them to already go ahead and preemptively do contracts with these people when they haven't even passed into law that they would do this, or even pass into the law any kind of appropriations for it? Because that's the deal. Congress holds the purse strings even at the state level, and here's Stitt trying to just muscle his way through and do whatever he wants. Hey man, we're going straight ahead with this. It's kind of like we did with his Sooner Care 2.0 plan. He tried to drive straight ahead with it, and what happened? Went right into the dirt, because that's what happens with Kevin Stitt. He drives everything into the mud. Everything's a big fiasco with this guy. And somewhere along the lines, I'm going to think there's $2 million out somewhere in this, because that seems to be Kevin Stitt's most faithful and magical number. $2 million. $2 million on a quack drug that doesn't work. $2 million on the fiasco with the Native American tribes where he got his butt handed to him and lost a third of the state. The big fiasco on giving $2 million for 10,000 face masks. So this guy is the master of 2 million. But so I'm thinking more like maybe this one is the 2 billion, because that's what that is, right? $2.2 billion of cost to manage this care system in Oklahoma. And he thinks that's a great idea. That's better than paying $160 million the way we had it before, with the hospitals paying in. And you know what? With this managed care system, he even said, hey, we're going to have to raise rates another $120 million on these people. Really? An extra 120. You know, that's just the kind of thinking you get with a guy like Kevin Stitt, who knows nothing of law or policy because he's not a lawyer and he's not a politician. Doesn't know anything about political science, doesn't know anything about law or how it's written or how they get passed. He's just a business guy, and that's how he's running this. He's running like a business, and it doesn't work because it's a government. You have to go to the legislature to get things happen. You just can't do things unilaterally like you do in your own company. It doesn't work that way. We actually set it up so it doesn't work that way. But can't tell that to Kevin Stitt, so he goes through and does all this stuff. Well, I'm going to tell you something. It's going to be really costly. They even say it's going to be. Right now, it's going to cost so much more to implement this. We're talking almost 4 times the cost to implement a managed care system plan, and they even admit it. And then they go, but in the long run, it'll save us money. No, it won't. Managed care doesn't. And that's the other thing they say. And this was a total BS line when they came out and said, you know what, of all the states that expanded Medicaid, they use a managed care system. I don't think that's true. I don't think they do. And not all of them have great health outcomes. Like they were saying, one of the places they wanted to use as an example was Texas, of all places. Their healthcare system isn't that great. It's not one of the better. It's not one of the top 10, but that's one they want to model after and say that they want to be a top 10 state. It doesn't work. It doesn't. And even Kansas, they modeled them too, and it doesn't work either. So here we are, bumbling Kevin Stitt because he got his feelers hurt because we passed 802, wants to come in and is trying to tell us how we're going to do it. But that's not how it works. So now we have a big fiasco going on. You got people suing him. We got medical associations, dental association, hospital associations going to the Supreme Court to make them stop the managed care because it's going to really devastate rural hospitals. Because this is what Kevin Stitt wants to do. He wants to raise the fee they're paying to cover the $2.2 billion by a bunch. And that's going to really hurt rural hospitals. It's really going to hurt them. So these people are against it. And when Kim David came out and said that people on this managed care thing, they just don't know, and she got censured for it, well, you know what? There's a little truth to that. Because even Kevin Corbett came out and said, on a question someone asked, hey, you haven't gone to the legislature, and the legislature's saying they don't know anything about this, and they didn't discuss it, and Kevin Corbett said, well, I know about it. I've been discussing it for months. I've been talking about it and working on it for months. Well, you know what you didn't do? You didn't go to the legislature and work with them on it. They need to know about it. It's not about you, Kevin Corbett. It's not about whether you know it. They need to be informed so they can vote on it. They don't just have to take your word for it, and neither do their constituents. That's not the kind of power you have. You can't do that. It doesn't work that way. And to think that you think it does, or that we should be fooled enough to think that you think we should be fooled enough to think it works that way, is just insulting. I don't know who this guy is. Never even heard of him. But here he is saying, you just need to listen to me, do this managed care program, because I'm going to pull out this appeal to authority, failure, and logic and tell you I know better than you. I know more than you. So you just need to listen to me and do what I tell you. And that's just not reality. And he's going to be sorely having his feelers hurt because it's not going to happen. And not only that, here we go. People in the legislature, and this is a deal here, and these are Republicans. These aren't. We know most of the Democrats are against this, pretty much all of them. But Republicans, there's a lot of them against this because they know how costly this is going to be. It's going to cost us a whole lot more money. We're going to have a whole lot less care, and it's going. But that's the plan. That's exactly what Kevin Stitt's trying to do. He wants to make it look as bad as possible because he doesn't want it. He wants to get rid of it. So that's the plan. We're going to make it look as horrible as possible, and then we're going to use a nice advertising marketing campaign to rail against it and get rid of it. And that's exactly how I feel they're going to do it. Or, maybe it's more cynical than that, and he just doesn't like it, and he just wants to put it to people who put it to him, or how he feels the citizens of the state put it to him because they didn't agree with him. They disagreed with him on this. A majority did. Yes, we did. We voted it in. A majority of people in Oklahoma. And Kevin Stitt thinks he can just unilaterally come in because he's a plutocrat. Thinks, I have the money that gives me the power. Citizens United people. So he gets to just, I do what I want because I'm the billionaire and you're not. But that's not really how it works here, is it? It's not. We get a say. We get to vote in our representatives, and those representatives get to represent us. Kevin Stitt's guy, Kevin Corbett, doesn't get to represent us. He doesn't. Not even Kevin Stitt gets to represent us. That's not how governorship works. And maybe he would know that if he had any kind of political acumen at all. Or even law acumen at all, which he doesn't have. And that's why we see these fiascos over and over again. It's the reason why he's like the second worst governor in Oklahoma history. I know some people want to say he's worse than Fallon, but I think she still holds the top spot. She was quite not just a plutocrat, but a kleptocrat as well. So this is what we got. I don't think Kevin Stitt's so much of a kleptocrat because he's already got quite a bit of wealth, but he loves that power. He loves being in charge. He loves that power. And how he gets it is because he's got the money. He doesn't need the money. These other people want it. He's got the money people want. So that's how he gets his power. He gives them the money, so he gets them on his side. And that's how it works. That's how he got elected governor. It's the same way he got elected governor. He uses his money to leverage power to put him more power. He gets more power that way. And that's how he does it. He gets these other people who pining for the money, because that's what conservatives do. They love it. They're plutocrats. And they'll take it. And they'll do whatever he wants. And that's how he feels. And he feels that that's how it should work here in the United States of America, in the state of Oklahoma. our state legislature hasn't even talked about it yet. They haven't even been able to. They don't know anything about it, and the governor's keeping them in the dark, which really isn't cool. This is so done untransparently. And when it's so untransparent like this, when you have a bunch of money, and he goes, hey, it's going to be $2.2 billion, I'm like, whoa, what happened to 160 million? 2.2 billion is, geesh, I mean, that's, what, 7%? Oh, well, that's 93% more cost than 160. And when you look and you're going, wait a minute, the dental plan to manage it is just 110 million alone. That's ridiculous. It's ridiculous. And this is what he's pushing through. Oh, this will be better for Oklahoma. We'll be a top 10 state. No, we won't. Oh, we'll be top 10 state only if you're counting from the bottom of the list. But I think it's an important issue. Something that we kind of missed. It's something that got covered. And then the snowstorm hit. Power outages, everything else. And we kind of got lost on it, so I figured I kind of want to bring this in the forefront. Here we are, managed care, Sooner Care 2.0, revisited, revised, reconstituted, and reanimated into some undead creature that's called managed care that's going to cost us $2.2 billion to manage. Instead of $160 million we would have just passing Medicaid and managing it ourselves. Talk to your representatives about Medicaid expansion. Let them know, hey, you know what? Fund it, but do it the way we wanted it done, the way we passed it. Don't let Kevin Stitt come in there and screw this up for us, because Kevin Stitt is in it for Kevin Stitt and his buddies. He could care less about you and me. This is Across the Desk with Kit Fairchild. We'll see you next week.